invite the panel. We'll be focusing on some of these areas that you've answered. So women's health, mental health, and lifestyle conditions. So let me take this opportunity to invite on stage. We'll start with Amar Patel. So Amar works for Goldstar, and you can find his bio on LinkedIn. But something interesting about Amar, and this is from his colleagues as well. So he wears many hats. So he's a pharmacist, a tax analyst, an accountant, and a fitness guru. So apparently, Amar believes that exercise is the solution. He's participated in a triathlon and swam in the River Thames. So karibu sana Amar. Then next we have Dr. Gabala. So not only is he a rockstar cardiologist, but something interesting about him, and these are his words, so please these are his words. He's a poor doctor who came from England and has been in Kenya for the past 5 years, and he loves it. So karibu Dr. Gabala. Next we have I should have mixed you. Next we have the ladies. So we have Dr. Claire. So Dr. Claire is an obstetrician gynecologist. And something interesting about her, in another life, she would be a mountain climber. But something interesting about Dr. Claire is she loves traveling. If she's not working as a doctor, she's somewhere traveling. So karibu sana, Dr. Claire. And then last but not least, we have Rubie Miseda. So Rubie is a psychologist. She is the founder of Jipendo Wellness. And something fun about her is she enjoys writing narrative poetry and short stories, and she says she's an emotional writer. So karibu sana. And so they'll be leading us on this panel session, and I'll hand it over to Amar, who will also be the moderator.
Thank you very much, Dr. Hope. For this session, we wanted to get expert advice from some of the best medical practitioners in Kenya. We thought that their insight would provide you some of the answers that you had, some of the questions that you had earlier. We can touch on them later regarding mental health, women's health, and cardiology, non-communicable diseases. So I want to kick things off on the mental health side with with Rubie. Since COVID, mental health has been a buzzword, not just in Kenya, not just in Africa, all around the world. What, in your opinion, does good mental health look like?
Okay, so maybe I can simplify it because I'm so used to talking to people from ethnical and cultural backgrounds. So what I usually tell them a good mental health is somebody understanding how their brain functions, learning how to build a healthy relationship with themselves, which means learning about your boundaries, learning about basically your story, how to cope with stress, and how to learn how to communicate that. This way you'll be able to learn how to navigate your life with other people.
Thank you, Rubie. Dr. Claire. So Dr. Claire is a women's health specialist. Again, another buzzword I think in the last few years is talking about menopause, perimenopause. I don't think it's a term that's well understood in society, especially from the men's perspective. I think women understand it a lot better, but I think there's a big gap in knowledge. So would you able to just kick things off by just telling us what is menopause, what is perimenopause, and what symptoms are people likely to face if they have this?
That's a very good question because some of the audience were surprised that women tend to be more stressed out than men in the workplace, but it's because we navigate a lot more complex health issues to do with the reproductive system. And one of them that's really not engaged or talked about is perimenopause and menopause. Perimenopause is a period of time in a woman's life, usually for us in our 40s, you start to transition. It's a transition phase where it can last from between 8 to 10 years, and that's what we don't pay attention to. Because you think menopause is one day, everything switches off, the lights go off, and we continue functioning. But you go through a period of transitioning where as the ovarian reserve or our egg reserve starts to go down, your hormones also start to change, especially so estrogen. And some of the symptoms associated with this directly impact how you work. For example, brain fog, memory, insomnia, your ability to pay attention and actually retain information, which directly impacts your productivity at work. Yeah.
Thank you, Dr. Claire. Dr. Gabala, I think there's been a worrying trend, and we've seen it with a lot of our clients in Kenya, that there's been an increase in cardiovascular disease across Kenya, and I'm sure the trend is across Africa as well. Why, in your opinion, do you think this trend is happening, and how prominent is it?
Well, in Kenya, like 10 or 15 years ago only, the most cause for mortality in Kenya was communicable disease like HIV, gastroenteritis, malaria. But now, for the last 10 years, the cardiovascular reasons for that are getting the same level as Europe or any other country in US or Western countries. The hypertension is a predominant disease here in Kenya compared to other countries. I start to see patients like 19 years old coming with high blood pressure. We don't know exactly why, but it could be related to the high altitude here in Kenya compared to the other African countries. Even the treatment for hypertension in Kenya is not the same like Europe. So the patient, if they don't react in a good way to certain drugs that we use a lot in England or other European countries. So hypertension is a predominant risk factor in Kenya. Then coming smoking, high cholesterol. There are families with very high cholesterol in Kenya here. We know some of them. We get the patient, we do our survey and audit. There are other reasons like diabetes. We have Indian community with predominant diabetes. All these are risk factors which make cardiovascular death is the number one in Kenya at the moment.
Thank you, Dr. Wala. And just touching on your point there, so what would you say, in your opinion? Obviously, you've mentioned that cardiovascular disease is getting worse in Kenya. How would you say that we should look at trying to prevent it? What can HRs here in the room, or what can individuals in Kenya do to help prevent themselves getting cardiovascular diseases?
So, best treatment is prevention. So, to find those people, when you have high blood pressure, you don't have any symptoms. So, the first indication for high blood pressure, you go to somewhere, you go to a camp, you go to pharmacy to get your blood pressure measured, and then you find out that you have high blood pressure. But there are no symptoms of high blood pressure. If you have headache, for example, it's not a sign of high blood pressure, it's a sign of complication, which means stooling. So to detect the cholesterol, of course, nobody comes to our clinic and say, oh, I have high cholesterol, without blood test. So you need to do like a survey, you go out in the community and you see those people before they get an incident, so they get like heart attack or stroke.
Okay, thank you very much. Dr. Claire, I want to come back to you on menopause and perimenopause. What are the current treatment options for people? Or what are the options in terms, not just medication, but what are the different things people can do to help with their symptoms?
It leans, just like what Doc is saying, it leans a lot on lifestyle as well, because diet goes a long way. We can get a lot of non-medical grade estrogens from our plant-based diet. So looking at how much vegetables you're taking in, your fruits in your diet, as well as your exercise, because one of the things that changes dramatically during perimenopause and menopause is the way fat is distributed on the female body. With estrogen, it's around the breast area and the hips. Without estrogen, it goes central. So we start to see a lot of cardiovascular disease and issues around that with health for women during perimenopause and after menopause. So it would be a very important thing to look at what your lifestyle habits are and start to develop them as early as possible. It's harder than you think to start when you're 40. Shifting fat as you get older is much harder. So if you start integrating some small steps within your daily routine, you'll find that you're more effective, even before we get to the point where we have to talk about medical support.
So exercise, you said, is the key factor to help with symptoms of perimenopause. In terms of medication, obviously we prefer people not to have medication, but if people do need medication, what are the best treatments in the market at the moment for perimenopause and menopause?
Another thing is it's very difficult to answer a question like that because it's not one size fits all. For some women, the symptoms are not as severe as others. So then just basic support with your diet, your lifestyle, and then support with some of just individual symptoms. So if we're talking about mental health struggles, you can have psychological support as well as medication for that. Hot flashes, depending on the degree of severity, can be treated on medication as well. And then for those who have very, very severe symptoms, or if it's also affecting other aspects of health, we start to look at hormone therapies, where we either, depending on whether or not your uterus is still in place, we would support with medical estrogens or combination of estrogens and progesterone.
Thank you very much. And I know I'm aware that we've got a lot of HRs and operation managers in the room here. What can we do to help spread the word and make awareness of perimenopause at work? Spreading the message across employees, because I know that Leah touched on sick days and absenteeism earlier. I know a lot of people, especially women, if you're having issues, don't want to come to work, or they're not fully focused at work. What can we do to help women at work who have got these conditions, who want to obviously still work and not obviously take days off?
The solutions are a lot simpler than we think, in my opinion, because maybe I throw it to the audience. How many of you have had a health talk to do with anything to do with your reproductive health in the workplace? A health seminar or wellness talk, anything like that? They're not as common as you think they would be. And yet, education and information goes a long way. Even before you start to think, how do I look for help? Do I go speak to HR? Do I go to the staff doctor? Who do I go to? If you're already having this conversation amongst yourselves, having specialists come in and talk to the employees about the health issues they should be looking out for, the symptoms to be aware of, it'll go a long way, even with creating empathy in the workplace, because it's not just to do with menopause. In women's health, we struggle from all the way from menstruation and menstrual health issues through to pregnancy and postpartum issues, parenting, breastfeeding. There's so many issues where if you're talking about it and you destigmatize, we talk about mental health a lot to do with stigma, we forget about women's health. And so if we started to have these conversations and you normalize them in the workplace, because sometimes you talk about menopause and you can see everyone go, ooh. You talk about your period in the office and everyone thinks you've lost your mind. Yet it's a normal part of your everyday function. So it's things that we can destigmatize from the office. It actually has a really good trickle-down effect even into the homes. And because of what you've learned, you might be able to assist someone else that you know. Or someone can come to you and speak to you about it and you're able to direct them to the right place so that they can get the assistance they need.
Thank you. So the takeaway message that I got from that were educating your workforce, and essentially helping get rid of the stigma that people have talking about women's health in society and in the office as well. Thank you. Rubie, touching back on mental health. So why do you think, and I think there's a lot of data that suggests this, why do you think since COVID that there's been a steep increase in people that are complaining with mental health issues?
I think first of all, there's been a bit more awareness. And as you guys know, that when there was lockdown, people started to socialize together. Families started to realize that they don't know each other. Domestic violence increased. And the isolation, the inability to express yourself, and people started to realize that home is not an emotionally safe space. As a person who practices here in Kenya and works with people from different ethnical, cultural backgrounds, I came to understand that a lot of people could not hide their emotions anymore, but they did not understand emotional management. Even to answer the lady who was shocked about millennials being stressed, one thing people don't realize that when you're raised from a cultural community, there are systems and traditions, and there's certain emotions that are not considered culturally acceptable. Most of millennials were raised in hyper-vigilant, dominant parenting styles, right? And each child had a different parental experiences. And what happens is that if a child is unable to articulate their emotions, then as they grow older, they will feel like the world is an unsafe space. So as the younger generations also come up, and they're the ones who are leading the whole mental health movement, they're starting to realize the concept of, fine, we can't find safety at home, but we're finding safety together, meaning that there's something wrong with the way we've been raised, which can affect how people experience stress. If a person is emotionally dysregulated, if a person does not understand their emotions, and that's why with mental health in Africa, we need to change the language. We need to start from the basic. What was vulnerability? Yeah, what is vulnerability? What does sadness look like? How do you respond? How do you react? How do you communicate? Because when you're raised in a system, and this is not only in the house, this is also with the educational system. Every system that I've seen has been do this, do that, conformist. So meaning emotional expression is something that is difficult. So then when COVID happens, and then everyone is online, you realize that, okay, the way I've been raised is there's been an issue.
So you mentioned there that people obviously struggle with mental health because of their family and their home situation. Obviously, what can we do? Again, we've got a room of HRs here. People come to the office to kind of get some peace and quiet or some solace from that stressful home environment. What can HRs here do to make that environment at work more, welcoming, so people have de-stress, which will also link to help better productivity in the office as well? What advice would you give to the HRs?
I think number one is psychoeducation, right? Doing a lot of workshops on emotional management, communication, boundaries, and also trying to normalize the conversation, because this is something very new. So you start with the basics, and also talking to them about stress management in terms of them understanding internal and external stresses. And also remember, people who work in HR are also, they also come from this society. So just imagine you coming to someone, what kind of emotional safety are you looking for? You want somebody who is understanding, somebody who can actively listen, and somebody who can communicate. So there are different tools, such as there's the Dear Man tool, which can help you teach people how to communicate what they need and what they want in a respectable manner. And then on top of that, you can also teach them about managing triggers. So what people don't realize is that in the workplace, there's so many different personalities. So at times, a person may be triggered and they may lead with that trigger. Yeah. So if they could learn how to, there are 4 steps of managing triggers, like how to take space appropriately. This will make the work environment feel more safer, because that means they're understanding how the person feels.
Thank you, Rubie. Dr. Gabala, we had a great chat last week, and you're telling me about some new technology we have in Kenya when it comes to treating high blood pressure, non-communicable diseases. What?
So,
yeah. Go on, take it away.
the problem with hypertension in Kenya, in particular, that only 17% of people with hypertension are actually taking medication. So only 17% of the patients with hypertension, they know that they have high blood pressure and they are on medication for that. And if you imagine that 50% of these 17%, they don't have enough medication to lower the blood pressure to the optimal level. And they continue like that for years until they have the complication and they come with a stroke, heart attack, or kidney failure. Kidney failure is very common here, and 90% of kidney failure, high blood pressure, which was not treated. The other problem that 50% of the patient with high blood pressure, they don't know that they have to take medication the rest of their life. It's not to take the blood pressure medicine and then your blood pressure gets better and then you stop after a week. Then you would check for 2 weeks, the blood pressure would be fine, and then suddenly it shoots upward. So that's the main problem in Kenya with the treatment of the high blood pressure. So that's why now most of the country in Western Europe and the US, they came with a new technique to treat the blood pressure. So the technique called renal denervation or RDN. It's a very common technique and it's used now for the last 2 years in Europe and the US. So technique is very simply to go to the renal artery and to burn certain area there with like microwave. You don't feel anything. So you burn the reflexes which goes from the kidney to the brain, which is the main cause for high blood pressure. After that, after 6 months, the blood pressure will start to go down and it will go down, we call systolic and diastolic. So the systolic will go down by 22 millimeter mercury, the diastolic will go down by 15 millimeter mercury. So if you are taking 5 medicine for the blood pressure, after 6 months, you can go down to 1 or 2. If you are taking 2 or 3 tablets, after 6 months, we can go down to 0. And that's for life. Of course, we have looked at that technique and there's absolutely no contraindication, no complication. The only contraindication if you have a transplanted kidney, then we don't do it. But all other patients, especially younger, who doesn't like to take medication, that will be a very important technique for them. So we have 2 big studies done, one of them called on-med and the other one is off-med. So they got patient with blood pressure tablet. Half of them have the technique, the other half continue taking medication. And after 6 months, there was no difference in the blood pressure between the 2 groups. One of them without medication, the other one continue lifelong tablets. So the question, if you have 2 tablets, yes, you can have the technique and you are responsive, then you will stop taking the medication. And that on the long run, it will be very cost effective. It will save you from a lot of medication.
Thank you very much. One thing I would also ask is preventative care for non-communicable diseases. If someone wants to have a health checkup or wants to check that they don't have anything, what are the main tests you would say that people should have to make sure they've got peace of mind they don't have any non-communicable diseases?
So the first, if we look at the cardiac causes for death, so all of us will die when the heart stops, of course. So some of us, it will happen when you are 40, 30, or even 70 or 80. So the most important test, I would say that if you only have money for one test, I would definitely recommend to have a stress test. That will come and we look at the heart at rest, and then we will do exercise, we will run on a treadmill, and then we will check the heart again after the stress. And we will see, in that case, we will detect those people who have narrowing and the coronary arteries getting heart attack and become a subject for sudden cardiac death. So all of us know that sudden cardiac death can happen to anyone, can happen at any time. There is no warning symptom sometimes, and that's the problem. But in some countries, we have like a regular health check, and even we started in Kenya here with big company and most of the embassies. They come and they have like certain check. They check the blood pressure, they check the heart rate, the vital signs that we talked about today. We check the cholesterol, which is very important. We check even uric acid, which can indicate the future for you. We check something called CRP. All these are blood tests. Then after that, we take ECG and the stress echo. So stress echo is 99% enough to say that if you will die within 3 years or not. Then you have to repeat it again after 3 years.
Thank you very much, Dr. Gabala. We've got a couple of minutes left, so I've got quick fire questions for some of the panelists. Rubie, what would you say, what are the key signs to, again, for these HRs, what are the key signs that they should look out for someone who's stressed at work, in the workplace? What are the key physical and emotional signs?
Okay, so one of them is irritability. The next one is fatigue. The next one is over problem solving. The other one is they tend to be absent from work, or they tend to self-isolate. And then at times you start to see that they're unmotivated at work. And what I would suggest for someone in HR is there are two simple ways, right? I had mentioned internal, external stressor. When you've identified somebody, and these are just a couple of symptoms that I've mentioned, just ask them. So an internal stressor, for example, is negative self-talk, right? Perfectionism, right? So people may have high expectations that they can't meet. An external stressor could be commuting. So if you can ask those basic questions, you can be able to start to understand, okay, there's something happening here, because stress is excessive pressure from different types of demands. So what you're trying to find out is different types of demands. And then also on top of that, because stress also increases levels of anxiety, an interesting way of you also trying to ask and bring out what's going on with them is asking them, what are your perceived threats that may be causing you intense fear and worry? What you're trying to find out is the threat. The threat is connected to the different types of demands that can also assist you in drawing out the stress. So those are just a few examples that you can actually use in trying to pull out whether somebody is going through stress and how you can assist them.
Thank you, Dr. Rubie. Thank you, Rubie. Dr. Claire, quick fire from you as well. Chronic conditions affecting women. What would you say the main chronic conditions are that affect women, which are different to chronic conditions that affect men?
So one of the things when we talk about women's health, just in general, we almost always focus on sexual reproductive health issues and nothing else. And yet we find that only contributes to about 5% of the reduction in productivity. Most women are affected by chronic conditions that either manifest differently in women or are more predominant in women. So things like autoimmune diseases, headache or migraine disorders, so things you've heard of lupus, you've heard of things that are just absolutely have nothing to do with necessarily the reproductive system. And if you're not paying attention to those and you're only focusing on reproductive health issues, you're going to miss out a lot on why some of your female staff members are not as productive as you'd imagine them to be. So on our end as medics, we're starting to look at, should we be looking at research in a different way and make it gender specific? So if I'm looking at cardiac disease, if I'm looking at hypertension, if we're looking at diabetes, how does it affect the female body as opposed to the male body? And how can we then apply management protocols or systems that will actually be effective for women? Because one of the things, and this is relevant to anyone working in an organization or a business of any sort, one of the statistics we have is that the women's health gap contributes to a humongous loss. We're talking of about trillions of dollars every year in terms of productivity and staff retention in the workplace. And so if you're not paying attention, and what does that mean? The women's health gap means that on average, women, we know that since I think the 1800s, we've been living longer. Average lifespan moved from 30 years, now we are in our 70s. For women, we also find that women tend to outlive men on average. However, women spend about 25% more time or years in their lifetime in poor health. And that contributes to a huge loss in your various industries, in your organizations. So until we start to pay attention and don't just think, okay, my health covers for pregnancy and it covers for whatever else you're thinking about in reproductive health, think outside the box. And encouraging women to use these covers is also important. Educating them and informing them that we do have a package that you can come in and have, like Doc has said, have your stress test, but pay attention to the markers that are more predominant for the women as opposed to just generalizing it for everyone.
Thank you very much. And Dr. Gabala, last word from you. Food and diet is obviously has got a big part to play in non-communicable diseases. What advice would you give to people in terms of diet? If someone came into your office, what would the first thing you'd say? I mean, would diet be up there in terms of, intervention?
Well, at the moment, what I got for the experience here in Kenya, that if the patient is normal weight and doing enough exercise, so I give him the freedom to eat what he wants. But I will tell him about the healthy diet, of course, and then he can stick for it. That's if he doesn't have any cardiac disease, and we call it primary prevention, that before they got heart attack. After the heart attack, for the first year, I give them the same freedom because we put them on drugs. Anything you eat, it will come out without absorption in the body. But that's only for 1 year. And then after that, the only advice that we have to give to them is to deal with the stress and to increase the exercise. So exercise, and you are normal weight, you have the liberty to eat a little bit freely, not as we hear in the media that you have to reduce the fat, you have to do that and all that. So normal weight. If you are overweight, yes, you have to stick to the rules. Primary, different than secondary prevention. Secondary prevention, you have more responsibility, but you have drugs that will protect you, and after 1 year, you have to go back and you have to go to the healthy diet, which is more fiber, more green vegetables, less meat, and less carbohydrate.
Thank you very much, guys. Well, thank you very much for the panel. I think that was really insightful. There's a lot to learn there. Yeah, so thank you very much.